Residents of Avetakpo in the whole West District of that region are calling on the government and benevolent organizations to immediately tool their health center. Despite being the only health facility in Avetakpo, it remains an empty shell years after its construction, with no medical equipment or staff to serve the community. As a result, residents are forced to walk several kilometers to seek health care in Adidome or Abutia, often under difficult conditions, further endangering lives in a community already burdened by poor infrastructure and limited access to essential services. ChannelOne News' Volta regional correspondent Despon Selasiago has more.
Avetakpo, a rural community in the Volta region, continues to grapple with a combination of health and infrastructural challenges, deepening the vulnerability of its residents. Weeks after a strange skin disease raised health concerns in the area. Despite having a structure earmarked to serve as a health post, the facility remains non-operational. Since its completion, no healthcare personnel have been posted to the facility due to the absence of essential services such as electricity, potable water, and accessible road networks. The situation has left residents without immediate access to medical care, forcing them to travel long distances to neighboring towns such as Adidome in the Central Town District and Abutia in the whole West District to seek treatment. Some residents who spoke to ChannelOne News recount how difficult it is sending sick relatives and pregnant women to the hospital.
Chief compound, yes, tomorrow. Never no ground chief compound. Fear more than 11 years. Your juggle fear. You always call Dala fear. One cake bear, echo. A dollar come every voting time. Ne piva. I grant you all want the Sierra. Go down district. District ko apples nuki. Nesu korolami kafe a. Mille fear and a camera jimo. Ne funo one kino I call you a donya of papa. Let me have you jet door. Miako ikoyi, obina na neviare knowledge kafe miano, ogaji nyaha. Zero, na ne camera jimo.
Efforts to connect the community to the national electricity grid have also stalled. In 2019, the government initiated an electrification project in the area, supplying electricity poles and some equipment. However, work on the project has not progressed, leaving the materials to deteriorate due to prolonged exposure to the weather.
2019 stage ya mi on to ipele contract antikula to pole mo fi o akavado yi ale fi o nya jo fi ko no nya yo ko bi ale no yo ale ko up to now to ko material so ma o ko dale to paro ka do ha o gbelefo ta light nya ha ya mi ko pon ko na won to va la po ga festi nya mo ya le ko to yi anti
2019 October mo ye ko ba je dogon o COVID-19 va gala ko va das ne bi ko ko va zido be nya la kama ga la ji ho ni ka nya ga se jo mi en pi mi o disi o pi o mi ga nya ga se jo bo ko mi a mi la manema.
The community's road network remains in a deplorable state, further compounding the crisis. The lack of proper access roads makes transportation of goods and services extremely difficult, especially for farmers who rely on nearby markets to sell their produce. Poor road conditions often result in post-harvest losses, affecting both household incomes and food security in the area. Gifty Agbezumo, a trader in the community, says several promises to construct their roads have yielded no results. Headman for the community, Prosper Zate, in a ChannelOne News interview, called on government and benevolent persons to come to the community's aid.
even now but up to Bunini. Already, rather Sylvia, and I be near a curve, which is not value. This I recommend in our plan later on. Already, my new perfume, and maybe the roller or
Residents here at Avetakpo in the West district of the Volta region are calling on authorities to put this health center into use to prevent them from traveling long distances to access healthcare. Reporting for ChannelOne is from Avetakpo in the West district of the Volta region. My name is Desmond Selasiago.
This is still the ChannelOne newsroom on